Dr. Christopher Davis from the Medical College of Wisconsin's Kern Institute joins us live to answer some of your questions. Dr. Davis, we just saw these new numbers. What do you make of them as a health professional as they change every day?
Right now, we're expected to be at the peak of the pandemic in Milwaukee, and the numbers, they're not skyrocketing. I cannot yet say that they've flattened out. We haven't necessarily made sure that we've flattened the curve, but there is some promising information in the way that the stats and the curves look like right now.
Mary also wanted to know if those that are high risk or the elderly will ever be advised that it is okay to go outside. Will that happen before a vaccine comes out?
Yeah, that's a really hard question. Right now, we don't even know when people are going to be advised to relax some of the restrictions. And it's going to be, I think, a long time before the higher risk population, elderly and those with comorbidities, are going to be recommended to relax.
Bud asks, if you wear masks and gloves, how often should they be changed?
It kind of depends on the mask and what you're doing. Right now, the recommendation isn't necessarily to wear gloves out in the community. The recommendation is hand hygiene, so frequent hand washing with soap and water for 20 seconds. But the general recommendation would be if you're going to go out, if you have to go out and you have a mask, you put that on or some kind of face covering, and you just leave it there in place and don't touch it as much as possible.
Carol asked on Facebook, can you catch this just from playing outside? Can you catch us outside?
Not really. Again, if you have to be really within 6 feet. Some scientists may say, a little bit further than that if you're in an enclosed environment. But if you're outside, away from people, nobody's coughing on you directly or touching you, that you shouldn't really be able to catch this disease.
Sharon asks on Facebook, if you unknowingly come into contact with someone who may have the virus or is carrying, how long would it be before you would show symptoms, and when would you be considered past the contagious time frame to others?
Sure. It could take up to a week or even longer. We don't still know 100% for the COVID-19 disease, but certainly it could take several days, a week or more before you start developing symptoms of infection, which you might not actually do. Some people just remain asymptomatic and not know that they even contracted the virus.
I've got a few people that have asked, including Marty, about blood tests to see if you had the virus. How would blood tests work compared to the swab test? And talk a little bit about testing for us.
Yep. So the swab test, that generally is a swab that goes to the back of the throat, and it is designed to detect the actual virus molecules that are there. And that is pretty rapid turnaround and tells you whether or not at that moment in time you have virus in your system. The blood tests are designed to test antibodies, and so what they do is they tell you further down the line if you ever did have the disease. And that's going to be an important thing epidemiologically once we start testing the population for the antibodies to see how many really did get infected with this during the pandemic.
People are constantly asking and saying this is no worse than the flu. Why have we shut down everything? Is it worse than the flu? In what way? And should we maybe have a bigger reaction to the flu?
Good questions. I would say that number one, it is worse than the flu. We know that the mortality rate from the coronavirus, from COVID-19, is greater than the regular influenza. And that being said, I think a lot of people are across our society not quite in tune with how many people actually die every year from the typical flu, tens of thousands, and that's why it's so important to pursue getting the vaccine every year, for number one, protection for oneself, but also the herd immunity, so that tens of thousands of people don't have to necessarily die.
And the general advice here for coronavirus would also work for flu season. Wash your hands, don't go to work if you're sick, et cetera, et cetera.
Exactly right. Exactly right. It's very basic things that we should probably just be more attentive to as a population. And maybe if there's going to be any silver lining, we're going to be more attentive to the plight of our neighbors and to simple things we can do to help spread disease.